Wow. All right. It was one of the federal government's most popular health care announcements. At the beginning of the year, hospitals required to disclose the cost of care for anything a patient might need. Fox 23's Rick Marinon found out, though, it's anything but clear-cut. This is a Fox 23 investigation.
When we began to look at hospital prices at the beginning of the year, we expected some simple things on just a few pieces of paper. However, we began to become cross-eyed looking at screens with all of this information, and I decided to print it out to try to actually highlight and take notes. What I found was digitally and physically, no one knows what exactly we're looking at. It was supposed to increase transparency and help you make informed decisions, but what I found online has many reaching for the headache and nausea medicine.
Yeah, that's, just like a foreign language to me.
I showed Lydia Moore, a mom with 2 kids, the prices for just one hospital in the Tulsa metro.
It's sort of overwhelming to the average family to try to sift through all the information, and you want to be able to advocate for yourself and make sure that things are being accounted for properly, but how can you possibly sort through all that?
But the prices on your computer aren't the prices posted everywhere. At the Ida Red General Store, the feeling was more like data overload.
I surely don't know what INJTX/DXIM/SQ means, or why it would be $206.
Abby Reed tells me putting prices online for consumers sounds like a good idea, but
I would say it's definitely not comparable to going into a store, being able to see and feel an item and look at its price right there.
The regulations say it's supposed to be as easy as shopping in a store, but compared to what the average American is used to, that's a false promise. I looked for what an INJTX/DXIM/SQ was. With the help of other websites, I figured out that it was some type of injection. I looked for it in 3 local hospital listings. It ranged from $206 at one to $36 at another. For a single procedure, you'll need to pay for numerous items. And Lydia says comparing all 3 hospitals and trying to match the items is just way too hard.
I think we all sort of fear the possibility of having some sort of medical incident that could leave you in financial dire straits for some years to come.
The Centers for Medicare and Medicaid Services, the agency that required the public price posting, simply told hospitals to post prices, but didn't require a format, guidelines, or explainers.
It doesn't seem like there's much of a standard for how to present the information.
Caitlin Donovan with the National Patient Advocate Foundation says since this is new, there will be some initial problems. What the prices don't show is what your insurance company may have already negotiated down for you and how to add things up for your final bill.
Before you go to buy a car, you actually have an idea of the price you're going to pay. Whereas if you walk into an ER, you have no idea. You can't even look on these charge masters and see what we call a facility fee, because there's maybe 5 different levels of facility fees, and they can inflate that to whoever they want.
Some hospitals have provided additional upfront pricing to make things easier. St. Francis has 2 pricing sheets, one that's heavily detailed and another with just the total cost of each procedure. St. John did not respond to my questions, but in statements to Fox 23, St. Francis and Hillcrest said nearly the exact same things. The website is a starting place and not the final price. It's best to stay in network and not jump place to place because of insurance and communication that happens between doctors working under the same health system, and they're more than willing to negotiate. Hillcrest notes you can discuss everything before a procedure, but asking a doctor not to use a certain device to save money is likely not an option. Both hospitals say they have programs and financial help for anyone, but they are focused first on care and the bill later. Inside this story on Fox23.com, we have posted links to St. John, St. Francis, and Hillcrest's main Tulsa campuses. We should note those charge masters do not list any prices or procedures that may be missing or may have increased or decreased in price when it comes to affiliated hospitals outside city limits. But when it comes to a money-saving tip, I can tell you right now, do not hit print, whatever you do when you are looking at these prices. Covering news that matters, I'm Rick Marinon, Fox 23 News.